In the recent spate of COVID cases, there was a home carer among the patients. As carers are the interface between the elderly and wider society, they are a key juncture in the fight against COVID.
To respond to Omicron, carers are stepping up their hygiene protocols again. We spoke to one carer about how he keeps his clients, himself, and his family safe.
The medical smock, gloves, and mask go on. Disinfectant alcohol is at hand. This is the daily uniform for home carers during COVID.
When I go in, I have to take my temperature and wash my hands, and then I'm always carrying alcohol on me to spray on myself. After washing my hands, we also have to pay attention to the client's own temperature.
Carers go into their clients' homes to help with preparing meals, helping the client eat and bathe, and accompanying them to the doctor. The job necessarily involves lots of close contact with the client, but when COVID cases are rising, hygiene measures must also get tighter.
We have to be especially careful if they have a fever, cough, or shortness of breath, or they feel fine one moment and suddenly unwell the next.
Home carers have come under intense new regulations since the Level 3 COVID alert was introduced in 2021. We're now in Level 2, but carers are still required to get double vaccinated, to take their temperature every day, and to monitor their health at all times. They're also forbidden to work in multiple districts and encouraged not to travel between districts.
Some people want to go home, and we'll do all we can to encourage them not to travel between districts. The pandemic is quite serious in Greater Taipei. If our family go into hospital, we may ask them to do a COVID PCR test. We'll insist they get the vaccine. Right now, we're adding the third dose.
For carers working every day with the elderly and with the clinically vulnerable, it's vital to stay on the ball, to be of service to those in their care.